Assalamu alaikum, bismillahirrahmanirrahim. Today our topic of discussion is combined hormonal contraception. This combined hormonal contraception, first we have to know what is this combined hormonal contraception. The definition I am talking about. So the combined hormonal contraception, we will know that definition. Give me 1 second. Okay, ji. So this Okay. The combined hormonal contraception means combined means two things. Two hormones which is we are they are combined, the estrogen and progesterone, and they have progesterone means they make there's different formulas of that one. Now we have to understand that this combined hormonal contraception means what. It can be pills, it can be patch, or it can be ring. So three things we are using in this combined hormonal contraception. It's according to the uh, uh, patient preference what she wanted to do it. But whatever we have to do, this one they will contain the means how much quantity they have it this hormone. This will be 20 microgram and 35 microgram. These are the one the this is the synthetic estrogen, ethidyl estrogen, EE. So this is the standard dose they are using it. Then more they, because we have to use this low dose combination. Why we have 20 and 35, not 50, 60 like this? Because if we will use more estrogen, the higher dose, she will have a risk of the DVT. This is the most important, because mostly this estrogen, the main aim of the estrogen to cause the um, this DVT. So we want to reduce that risk. That's why we have to use it low dose estrogen. Okay, ji. So other doses are available 35, 50, that one, but the most common in use 20 and 35. Okay. So what we are going to have it this estrogen. Then the what about the progesterone? The progesterone they make it uh, uh, like a natural towards the natural progesterone, but they make different formulation. This different formulation of this progesterone. Okay, this they make it synthesized, na. They are all synthesized one, estrogen or the progesterone. Now the other thing is that they make it that one, sorry. Now they call also the different generation. They give the name of the generation of these tablets. First generation, second, third, and the newer one. This they call it fourth generation, or they call it new this new generation. Okay, the first generation is the norethiosterone. They call it NET, and the second met levonorgestrel LNG they call it, and the third generation is desogestrel or gestodin, norgestimate. These are the names, and the newer one is the dorsiprenone. Then denogest, the another name. So just only remember the name, the first generation, second generation, third, and the fourth. That's all. We don't need more than that one. Okay, ji. Means what are the methods available? Here, everywhere in the world, methods are pills, then the patch, and then the ring. Okay, this is the one I told you. These are the one. These are the method. Now there is they call it pills, means the coloring of the pills. They put the same quantity of estrogen and progesterone. These are called the monophasic pills. Then we have the multiphasic pills. Multiphasic means they given in the different color. If it is coming in the different colors, means different phase of the COC, estrogen and progesterone they are using, and it is they make with the colors one. But they, according to them, this monophasic and the multiphasic, the most common in use is monophasics. The same color they will give us. Okay, when we'll do this milk pills, I will show you this monophasic. But in multiphasic there is no difference. Okay, because this is the quantity difference. they make it estrogen and progesterone, so that's why they put that one. uh, so not more in use. Now the other thing is that how this contraception work. The contraception, COC, means combined hormonal, some they say COC and some they say CHC, combined hormonal contraception, or COC means combined oral contraception. There is a difference. Combined hormonal contraception means he want to say about all the three, pills, patch, and the ring. But if he says COC, means he is telling particularly. COC means combined oral contraception. O means oral. Combined oral contraception. So that's it is not the hormonal. Hormonal will be three, we can say. Anyway, so the how the we will use it. You know, there is a regime to use that one. Two type of regime they make it, that one is standard and the tailored one. So we will do that one. This now the way which we have it. So traditional or the standard way which we call it, we use this 21 7 days. 21 by 7 means 21 means 3 weeks, and 7 pills in each week we have it. And the fourth week is called the hormone free interval, HFI. This is they call it. Okay. So what it will happen every month, what will have a withdrawal bleeding will be happen, and it can be heavy, painful, or simply unwanted. Some they don't like that they have the menses. So and this hormonal free in interval may be associated with symptoms like the headache and the mood changes. Here the ovarian suppression is reduced. The main aim of these hormones are to suppress the ova to be released. Ovarian suppression they are doing. So the follicles will be not developed, and so follicular, and if she is missing the periods, and this follicular will start to develop in this 7 days hormonal interval, free interval. In this one, the one inactive pulse, so follicle will start to develop. If she is late to take her pack, next pack, then she has a more risk of the ova to be released. Finish. Now we have to take the other method, which is a standard method, traditional method, which we call 21/7. Okay, there is another method which we call it tailored non-standard method. This is here what this method means, they will reduce the frequency of hormone free interval. Means this is called extended regime. Okay. Okay, we will do the same time the underlining. Okay, ji. So here what we have it, this is the tailored we are doing. Okay, frequency of hormonal free interval, it is decreased, and it is called the extended regime. Okay, ji. So what here we will consider our like better to make the tailor the table. Here what we have is standard, what we will use in a standard use, what we are going to do, 21 days we will use the active pills, and means pills whether it is ring or the patch. These are for 21 means 3 weeks, and the hormonal free index interval, sorry, HFI, hormonal free interval for 7 days. Means 7 days she will not use any pills, or some they use it, there is a pill are there, the color is different, these are called the sugar pills, they will take, or inactive pills. If some they want they can take it, or others some they don't want to take it, but they have to remember the periods. Okay, 7 days she is not supposed to take it. So this is the standard use which we do it, everybody use that one. There is another way, this is called the tailored use. In tailored use what is going to be happen, hormonal free interval is reduced. Means instead of 7 days, the first one they will shorten this period. So one will they will use it, that one shorten the hormone free interval. So they will use instead of 21 days active pills, rings, or the patch, they will this shorten the period, they will make it 4 days, 4 days only. Okay, after 4 days she will start another pills ring or this patch within 4 days. Means 5 day, day 5 she will start that use. And then extended use means this is tricycling, means 3 week 3 month. 3 month will be what? It will be 9 week. Okay, 3 month means 9 week. Three every three means see, 3 weeks means 21 days. Then she will make it the second cycle, the continuous, she will make it for 3 months, 3 weeks, 21 days, and then the third month 3 weeks. So it will total, it will become 9 week. 9 week means 9 week she will use pills, patch, or ring, whatever she like it. But that then after 3 months she has to give the 4 days or the 7 days inactive pills period, a hormone free interval, 4 days or the 7 days. She will not take any pills. Or she can use it another method, extended means, and another way is called the flexible extended use. What is this? Means flexible extended use means she will continuously use more than 21 days of the active pulse, patch, or the ring until breakthrough bleeding occur for 3 to 4 days. Means she is taking continuous without stopping. But what happens until she get the bleeding? That's the period. This is the hormonal free interval. So this bleeding will occur 3 to 4 days. Though she is taking that pills, but she start to have a bleeding. But this bleeding has to continue for 3 to 4 days. So this will be the 4 days hormonal free interval. And one is the continuous use of the active pulse, patch, or the ring, and there will be no hormonal free interval. So this is the regime which we are supposed to remember. Okay. The another way is that how does the contraceptives are effective? Contraceptive effectiveness, which we call it effectiveness, the 7 day intervals is the means what they are doing it, how it is affecting the risk, means considering the ovarian active in the hormonal free interval as an indication of the risk of the pregnancy. What happening in this hormone free interval, the hypothalamus pituitary ovarian axis start to activate. Okay, if they are start to activate, and she has to use the next pill next week, means that active pills on the days, because if she will make extended one, she forget to take 7 days, maybe she start to take on day 9, day 10, then what is happening, she has a more risk of the ova will start to be released. So that's the problem, she has a risk of pregnancy. Okay, because a risk of pregnancy. But if she will be on the standard or the tailor regime she is taking, then she will reduce the risk of the release of the ova. That's the thing which we have to understand. Okay, now we finish that one. Then the bleeding pattern, now I already told you, na, some they have the heavy bleeding, some they don't have the heavy bleeding. Okay. Now the important question is that when we are making the counseling to the patient, when she is supposed to start the CHC, please remember one thing, that CHC means combined hormonal contraception, COC means oral contraceptive. Here we are talking about all the three, this one, pills, patch, and the ring. So he is telling, who is a medically eligible woman, she can start that this CHC. What is the meaning of medically eligibility? Means maybe she is having a DVT, they are not supposed to take the tablet. Maybe she has a breast cancer, she is not supposed to take this, the combined hormonal contraception. That's what he is telling, medical eligibility. Okay. So what they are doing, mostly they will start to take that tablet day one. Sorry, from day one she has to count, means free interval of the bleeding on the 5 day of the menses she start. fifth day of the menses, and at that time she don't need any additional contraception. So she will do on the day 5 of menses, she will start the oral contraceptive pills or the patch or the ring. Okay, so this is the one she started. Okay, ji. Then this what happened if it is reasonably certain that the woman is not pregnant. She is not supposed to be pregnant when she will start that regime. Okay, but if she thinks she's not taken the previous pack, she missed the pulse and she's doing something, then she's supposed to do the pregnancy test. That the next pack start on day 5. This is the thing we have to regime. Okay, this is the thing we do there. Then what is the thing? Uh, okay, okay. The thing is that how she is going to start that one. If natural menstrual cycle she is having it, so day 5 she can start. She don't need day 5 for menses. She can start her this pills patch CHC she can start. She don't need additional contraception, means additional contraception she don't require. Okay ji. But what happened if she is amenorrheic, means any woman, like most of the women polycystic ovaries, she don't have a menses, and she want to start the this pills. So what she pills patch, what combined hormone CSC. Anytime if she is certain of her cycle that she is not having a unprotected sexual intercourse, she can start anytime, but she is has to be certain that she is not pregnant. Here, what we needed here, she has to use the this one additional contraception. Additional contraception means she's supposed to use the condoms, okay? And this one, what she said, that's the only thing we have it there. Now, other thing is that uh, then how effective these are, these contraception, how effective they are. If she is taking them regularly, not missing the things, they are very highly effective. Perfectly, if she uses, they are very highly effective. Okay, highly effective. They say 99.9% if she use the perfect. And she has a risk of the unplanned pregnancy in this CHC 0.3%. 0.3% they can have a this perfect use. She can have a 0.3% of that unplanned pregnancy. Even she is using in the first years of use, she can have that one. Okay ji. Failure, this is the meaning, means failure. She can get pregnant. 0.3% woman they can have it that pregnancy. Okay, if we will consider this table, if she is not using any method, no method she is using, no contraception she is using, okay, she has even she has how much risk of 85% risk that she can be pregnant. And another method is she can have it fertility awareness methods. What they are means, these are the methods they will check for the mucus, how mucus is thick, and but for this she need to have a regular cycle, na? So she's having a 24% risk of getting pregnant. Yeah, unintended pregnancy. Female diaphragm, male condoms, she can have a risk of 2% pregnancy risk, 2%. Combined hormonal contraception, 0.3%, she have a risk of getting pregnancy. For us, this is most important. But if we will consider, they can ask, okay, copper IUCD or LNG, this Mirena, how much risk? 0.6%. 0.2%. These are the risks. LNG 0.2%, but the copper she has a 0.6% risk of getting um, get pregnancy. She can have a risk. Okay. This is the effectiveness. Okay. This one, the other, now we have to consider other thing. Is contraception effectiveness affected by the obesity? This is the most important question patient can ask it, because nowadays it has become obesity common thing. So he say the question is that there is no association of BMI, high weight body BMI, height weight ratio, to the effectiveness of the COC. But they say that if the woman has a weight more than 90 kg, the effectiveness of the patch will be decrease. Okay, reduction will be there. Patch reduction will be there, but OC there is no association that effectiveness of the COC will be decreased, but there is no problem with that COC, but the problem is with the patch. The patch. This is the one patch. It will be, if her weight is 90 kg, it will be reduction. This is the thing we have to understand. It will reduce if she is a, okay, if she has a bariatric surgery, because if she is having a very heavyweight champion and then she done the bariatric surgery, what we will do? What is this bariatric surgery? It will be reduced. Effectiveness will be reduced. Okay, we have to know. Then she has to take the extra precaution. Okay. And the other question is that drug interaction. Drug interaction, we have two type of drugs, which enzyme inducing or non enzyme inducing drugs. Which if she is using enzyme inducing drugs, mostly we can say that enzyme inducing drugs, the most common one are the epileptic drugs. So if she is using enzyme inducing drugs, we have to inform her that the effectiveness of CSC is reduced. Okay, it will be reduced for after stopping and for enzyme inducing. And so what she has to do, this enzyme inducing drugs, we she has to use a reliable contraception method for that one. So what we have in our mind that it will be this affects, this enzyme inducing drugs, a short effect and the long term effects. So if she is using up to 3 months this enzyme inducing drugs, then there is effectiveness, it's not so much going to be decreased long term or the short term. But if she is using this enzyme inducing drugs long term, then she has to use the other any contraception, means this one contraceptive effectiveness drugs, she is supposed to use that one. So because you know that because these drugs they will go this metabolism through the liver, so it will reduce that these methods. So better she has to use the intrauterine contraceptive devices. Okay, or the progesterone, this one intrauterine contraceptive, or the progesterone only injectable is the best one. They are unaffected by enzyme inducing drugs, and this is a very important question for the what we call it for the this MCQ. So intrauterine contraception method, intrauterine contraceptive methods, and that one progesterone injectable. It is the one. The if she is taking enzyme inducing drugs, there will be no reduction of that one. Means reduction means what, failure of the these this CSC. That's the meaning of that one. Okay. So what we are going to do now, that we will advise these women, advise them to switch the contraceptive method. Okay. That's the thing what we are going to tell her. Okay. See, if she is using short-term use of enzyme-inducing drugs less than 2 months, can be managed with flexible, but long-term use she has to change that one. Okay. If she is using lamotrigine, okay, So this one, this will interact, lamagin will interact with CSC. So she has to, it will reduce her seizure control. Okay, and then she start to have a lamotrigine toxicity. So this one she has to switch the method of the contraception to other methods. Okay, the one which we talk about, IUCD, and she can use the progesterone injectable. This is the most important thing she is supposed to do. Okay, we are talking about the lamotrigine if she is taking. And what about the antibiotics? If she is taking non-enzyme inducing, there is no problem. She can use any antibiotic. She can use it. Broad spectrum antibiotic which she is using. She can continue that one. Okay, Ji. There is another thing. The woman, she is using that one EC, emergency contraception pills. Okay, it means what she will do. If she use the ulipristal acetate, she has to wait 5 days after taking ulipristal acetate before she will start the new pack. She will start the CSC. Okay, so if means emergency contraception, she has taken ulipristal acetate, then she has to wait 5 days before starting her CSC. The pills patch and the oral pills patch and the ring. So 5 days she has to wait if she is using ulipristal acetate. Okay, she can use that method. What is ulipristal acetate? Ulipristal acetate is a selective progesterone receptor modulator. Okay, it is consist of the progesterone. This is that's it is contained, and this is an emergency contraception. Okay, this is an emergency contraception. Ulipristal acetate. Okay, she has to delay 5 days, then she can use it. That one. Okay, this is the thing. Okay, now other question is that if she is having a severe diarrhea and the vomiting, what she will do? If she is using COC, she has to advise that contraceptive effectiveness is reduced by vomiting and the diarrhea. This is the thing. So if she is having a vomiting, if there is a vomiting within 3 hours of taking the COC, or the diarrhea she is having occur more than 24 hours, then what she is, we will advise her to use the non oral contraceptive if diarrhea or the vomiting persists. Okay, ji, so what is the meaning of that one? So it will reduce that one, no? So what if within 3 hours she reduce? She vomited, then she has to take that pills, another pill. This is the one they want to say that one. Then incorrect use means missing CSC. So we will do this one in another. After finishing this one, we will do this missed. If she missed the pills, the patch, and the ring, what she is supposed to do, we'll do it that one. Okay. If okay, we will say okay. If she will pill, one pill is missed more than 24 hours, then what she is going to do? She will take as soon as she remember. She has to take that missed pill, and she's supposed to, like Sunday, she missed the period of Saturday, then she has to take the Saturday pills, and then on the same day, same time, which she is taking the CSC, she has to take that tablet. So she has to, on that day she has to take two tablets. Or okay, this is the thing they want to say. There is a very important thing. They are related with the weeks. Which week she missed the pills? Better we will do with the color one. We will leave this thing right now. Okay, what are the benefits? This is the most important question of the exam. Non contraceptive health benefit. There is a risk of using CSC, and there is a benefit using CSC. So, what are the benefit which we are having? This one health benefit, na? It will reduce the heavy menstrual bleeding, okay, menstrual pain, and improve the acne. The best three use of CSC are uh, means the if she is having a very heavy menstrual bleeding, it will reduce that bleeding, the pain will be reduced, and acne will be improved. This is the most important benefit. And other benefit are the postmenopausal postmenstrual syndrome, they will also benefit. In the postmenstrual syndrome, it will improve by taking this one, okay. And if she has the some women, they have a endometriosis, so it will reduce the risk of recurrence of endometriosis after surgical management. If she has done the surgery for the endometriosis, then she has to use CSC continuous regime. This will reduce the risk of the recurrence, okay, of the endometriosis. And they are very best, CSC are very best to use for the acne. Those women who are having the acne, the hirsutism, and menstrual irregularity, it will make for the regulation of menses, it will be best. And also for the woman, she is having the PCO. Okay, it will reduce the risk. And the most important cancer risk which is reducing is endometrial and the ovarian. Ovarian and the endometrial cancer risk, it will reduce with this, with the use of CSC. And also the colorectal cancer. So three cancer risks it will reduce: endometrial, ovarian, and colorectal cancer. These are the one. This we have to remember. Okay. Then another question is that one, what are the this what we call it? What are the risks? Health risk. If she is taking the CSE, what the health risk she got going to have it? The most important DVT, the most important risk she can have it, venous thromboembolism. This DVT risk she will have it. And with this the use na with the use it will be 3 to 3.5%. Okay, this the one. It is a small risk, but they can have it there. Okay. Okay, one important race. What other race she can have it? Uh, because VET is the most one they are telling it. And deep vein thrombosis. She can have other race, arterial thromboembolic disease. She can also have with this one. Then arterial thromboembolic diseases, she can have an increased risk of a small increased risk, very small increased risk of this MI, myocardial infarction. Okay, if she is using higher dose of COC, that's the one thing she has to remember. If she is taking higher dose, okay. Then other thing is that for us, other complications she can have it, migraine, migraine, and MI risk she can have it. That's the most important risk she can have it. Okay, she has a small risk. Just we remember a small risk of the breast cancer. She have it. The risk with when she is using this CSE. Even she will stop taking it. It will reduce. It will take time to return to the normal. The breast cancer risk. So those women who are having a breast cancer history, family history, they are not supposed to use that one. Okay, she can have other risk of the breast cancer, cervical cancer risk. She can have a cervical cancer risk. Okay, using of that one. So these are the most important risks with that one. Other risks, the normal common risks are that one: headache, nausea, vomiting, dizziness, and breast tenderness. These are the most common risks. She is having it most commonly. Side effect, which we call it the side effects. We have to remember the headache, nausea, vomiting. Okay. with this one. So now what we are going to understand that the most way they say there is no evidence that she will with the use of CSC she will have a increase in the weight gain, or she will gain the weight more when she will use it, that one. Okay, now other things is that they say that effect of the libido, it will decrease. They say different according to the different control. And another question, the return of the fertility, there is no evidence that will it will reduce the long term use will reduce the fertility. Okay, as soon as she will stop, fertility will be returned. Okay. Okay, it is suitable for those for whom we just discussed now suitability of CSC in individual women. If she don't have a history of the breast cancer or cervical cancer, we are not supposed to give them a history of DVT. They are not supposed to use it. What examination, breast examination, cervical screening, test for thrombophilia, hyperlipidemia, or diabetes, or liver function test, it is not required. Prior to initiation of the medication, they don't require that one. Okay, she has a history of the any cancer, the and CSC are unsuitable, offered alternative method. She has to use the alternative method if she has the medical history of that one. So that's what she has to use. Yes. Okay, other question we have to ask about the most important. If she is going for surgery and she is going for surgery and maybe she has some problem, some accident happened to her and she is not mobilized, she is on the bedridden, she can have it if she is bedridden and we have to stop that one uh, 4 weeks 4 weeks until that problem is resolved. Whether it is surgery, if it is surgery, but if she is supposed to be long term bedridden, then she has to use it another method instead of CSC. That's the most important thing. Okay, and then supply from the government health clinic. They can take it for free. And what about the follow up? What follow up to she has to come yearly, okay, for the follow up. And but if she is a high BMI, every visit she has means whenever she will come, she has to take her blood pressure. That blood pressure is controlled. Thank you so much. One thing more, if the patient is traveling, she has to stop her this should be because it will reduce her risk, it will increase the risk of DVT, so she has to stop this one before her flight, at least 1 week before her flight. She is supposed to stop her combined SCSC. Okay. Yeah. See, it is CSC increases risk of DVT if associated she is traveling. So, okay, she has to use alternative one, or the best one she can use it. Use the compression stocking or antiplatelet drugs. If she is going long term, antiplatelet drugs she has to take, or she can take it the this stocking. She can use that stocking. And if she is living on the high altitude, or she is going for the trekking, 4,500 meter height, high she is going. So more than 1 week she is advised to stop that one more than 1 week, or consider switching to a safer alternative method. Okay, high altitude. 1 week she has to stop for the period of 1 week. Okay, and then she has to use another alternative. This is the one. Because in higher altitude she can have a dehydration, and dehydration will increase the risk of the DVT. That's what he wants to say. Okay, surgery, if she is going for surgery, at least 4 weeks prior to the planned surgery. Okay, she is not supposed to use it. Okay. The most important other question is that how long she can use this CSC. She can use this CSC up to the age of 50. Best. Contraception until the age of 50. This is best for her. Okay. And I think this we finish it. Thank you so much.